So our first presenter of the day is Dr. Diane Mcdonald. Diane completed her PhD at the Human Development Program in the Department of Educational and Counseling Psychology at McGill University. She's a part-time instructor at Concordia University, teaching courses on inclusive education and evidence-based practice in the Department of Education Child Studies program. Her research focuses on strength-based interventions that target a child's strength to support challenging areas. Diane's background and continued work as a speech-language pathologist, concentrating on autism spectrum disorders and reading disorders for preschoolers, school-age children, and adults motivates her to study and develop evidence-based practices. Please welcome Diane.
Hello, everyone. My name is Diane Mcdonald, and I am honored to be presenting my research at the annual Pursuit Award competition. Thank you to the Holland Bloorview Foundation, the Ward Family Foundation, and the Bloorview Research Institute for recognizing my research. The title of my thesis is Understanding Emergent Literacy and Improving Reading Comprehension of Preschool Children with Autism Spectrum Disorder and Hyperlexia. I want to start by asking you to read some words. Brabium, umble, snood. I'm sure you could all read these words as I just did, but I bet most of you don't understand their meaning, and that's intentional. You've just experienced hyperlexia. Hyperlexia is a reading comprehension disorder accompanied by a strength in advanced early word reading, and it's most commonly associated with autism spectrum disorder. There were two major questions that drove my research in hyperlexia. First, how do preschoolers with autism and hyperlexia learn to read at such an early age, as young as 2 years old? More specifically, are they learning to read in the same way as typically developing children? And how can preschoolers with autism and hyperlexia learn to understand what they read? For both these studies, I recruited 30 participants from Montreal and Ottawa, 15 with autism and 15 with typical development. They were all between the ages of 3 and 5 years, 11 months. They spoke English at home. They had an interest in letters, words, or could read. They had no history of formal reading instruction, and they all had normal hearing. Within the group of children with autism, they were further divided into those with hyperlexia who met the 5 criteria according to Needleman, and the remainder were assigned to the group without hyperlexia. My first study, entitled Early Word Reading of Preschoolers with Autism with and Without Hyperlexia Compared to Typically Developing Preschoolers, was published in the Journal of Autism and Developmental Disorders in August 2020. And this was the first study to look at an exclusive group of preschoolers with a sample size larger than 2. I'll just briefly discuss this study and then spend more time on study 2. In this study, I compared emergent literacy skills of phonological awareness, phoneme-grapheme correspondence, and letter naming of preschoolers with autism and hyperlexia to 2 control groups, the typically developing group and the group with autism without hyperlexia. According to the National Literacy Panel, for typically developing children, these are the 3 emergent literacy skills that are prerequisites to reading that develop before children start reading accurately and efficiently. Phonological awareness is the ability to manipulate sounds in spoken words. To think about phonological awareness, think Dr. Seuss. So rhyming, segmenting syllables like separating cupcake into 2 words, cup and cake, or identifying sounds like cat and can and cap. I'll start with the k sound. This was found to be a challenge for preschoolers with hyperlexia, in agreement with 2 other studies where one had a small sample size and the other mixed participants of preschoolers and older children. As children are exposed to print, they develop phoneme-grapheme correspondence, that is the ability to assign the sound to a letter. For example, B says ba. And this was found to be a challenge for preschoolers with hyperlexia, similar to a previous study with a small sample size. And finally, letter naming is the ability to name the letters of the alphabet. And this was the only emergent literacy skill set found to be a strength. So thus the results are in agreement with previous studies of smaller sample sizes or those mixed with older children, indicating that preschoolers with hyperlexia are not following the same pathway to reading as typically developing children and are thus following their own unique path. The next steps will be to examine exactly what this unique pathway is. My second study, entitled Early Reading Comprehension Intervention for Preschoolers with Autism Spectrum Disorder and Hyperlexia, was accepted for publication in the Journal of Autism and Developmental Disorders just last month and focuses on helping preschoolers with autism and hyperlexia improve their reading comprehension. And to that end, I created a parent-supported tablet-based application that targets reading comprehension at the most basic level, word picture matching. This intervention is based on the simple view of reading that states that the product of word reading and listening comprehension equals reading comprehension. As applied to children with hyperlexia, these children have strong word reading, but weak listening comprehension that leads to weak reading comprehension. And therefore, according to this model, to improve reading comprehension, we need to focus on listening comprehension. And in order to do that, this is based on the dual coding theory that states that the image plus orthography, or the written word, leads to increased receptive vocabulary acquisition. So if we think back to these words, brabium, umble, and snood, to understand them better, we can pair them with their image, brabium to prize, umble to flower, and snood to hairnet, and you've just increased your receptive vocabulary. Here's an image from my intervention app. There are two phases of this app. This is the listening comprehension phase, where the child both hears the word spoken and sees the written word simultaneously, and then touches the correct image. Once they've acquired the word at the listening comprehension phase, they're then exposed to the reading comprehension phase with the same word. And now they only see the word and then match it to the correct image. The intervention advances in complexity to phrases and then sentences. This study was a repeated measures A/B design, and all children and their parents were evaluated at time 1 prior to a 6-week no intervention period, where parents were asked to do what they normally do at home with their child. The no intervention period was to control for and compare to normal developmental growth. At time 2, only the children were again seen for assessment prior to the intervention period, where parents were asked to support their child's use of the tablet intervention at home for 5 days a week, 15 minutes per day over a 6-week period, and to use the tablet intervention as they would a book, like by commenting on pictures, sharing experiences. All children were finally reassessed at the end of the intervention period at time 3. I assessed reading comprehension, listening comprehension, and expressive language using standardized measures at the 3 time points. Here's the results for reading comprehension. Although there were no significant differences among the groups for reading comprehension at time 1, there was a significant increase in reading comprehension scores post-intervention from time 2 to time 3 for the hyperlexic group here in orange. These results indicate that the scores on reading comprehension were significantly higher following the intervention period for the group with hyperlexia. For listening comprehension, there was a significant improvement in listening comprehension scores from time 2 to 3 for all groups taken together, but not for time 1 to 2, which was a no intervention period. This indicates that listening comprehension scores were higher after the intervention as compared to before the intervention. And finally, for expressive language, we found there were no significant improvements in expressive language. So I won't show you that graph. This novel tablet-based parent-supported reading comprehension intervention demonstrated improvements in reading comprehension scores for the group with hyperlexia and listening comprehension scores for all groups taken together, but had no effect on expressive language scores. If we look back at the simple view of reading model, the group with hyperlexia we know has strong word reading skills, but now post-intervention, they demonstrate improvements in listening comprehension that lead to improvements in reading comprehension. This is the first study with the largest sample size to clarify the early word reading profile or emergent literacy profile of preschoolers with autism and hyperlexia as different from TD children. So this study provides a greater understanding that helps to develop best practices and potentially shape policy to appropriately target their specific learning needs at home and in the classroom. This was also the first reading comprehension intervention to begin at the preschool level that improves both reading comprehension and listening comprehension. This represents a paradigm shift in teaching reading comprehension because typically reading comprehension is targeted in grade 3 or later. And although my sample size was small, the results are encouraging and suggest we should be teaching reading comprehension earlier at the first signs of hyperlexia. Parents were able to successfully deliver this intervention at home, which means it can be used as a valuable stopgap while awaiting public services. And this strength-based intervention shows that targeting a child's strength to improve areas of challenge is a successful model upon which to base future interventions. And finally, it was encouraging to see that the benefits of this intervention extended beyond the group with hyperlexia to those with and without exceptionalities. Thank you to everyone who supported my research, especially the parents and their wonderful children. And thank you for listening.